Hi, welcome to Sunrise Health GME Consortium Program in Emergency Medicine. We're located right here in sunny Las Vegas, Nevada.
I'm Dave Hart, the Program Director. I want to show you around our stomping grounds and give you a better idea of what it's like here at Sunrise Emergency Medicine.
And hi, I'm Suzanne Rosendahl. I'm the Associate Program Director. We've been continuously accredited since we started in 2017.
Our residents rotate at 2 different hospitals. Home base is right here at Mountain View Hospital. Mountain View is located in the northwest part of Las Vegas. Mountain View is in a suburban part of the city. We see a diverse population and a wide array of medical complaints.
Mountain View is a certified stroke center and chest pain center. We're surrounded by many skilled nursing facilities and complex care, so we get lots of critical care.
And we have world-class recreation! Yeah!
The admission rate here is about 30%, and the ICU admission rate is about 10%. And as you can see, much of our department is brand new, and the staff here is excellent.
This is Sunrise, our secondary site. We're a large inner-city hospital just 2 miles from the Strip. As a matter of fact, we see more EMS traffic than anybody else in the state. We see it all.
Las Vegas attracts millions of tourists per year, which means at Sunrise we get to treat a lot of those tourists. It adds some interesting challenges to our treatments.
When you're an emergency department that sees over 120,000 patients a year, you need a well-oiled machine. And these are the folks that make it happen.
Hi, I'm Yaron Ivan. I'm a pediatric emergency medicine physician, and I work at Sunrise Children's Hospital Pediatric Emergency Department, where we see about 50,000 children every year. Children with URI and viral illnesses, all the way to kids in cardiac arrest, and now officially we see trauma patients. We have very, very good PEM physicians. All of them are fellowship trained and are excellent educators. They love working with residents, fellows, and love providing PEM education.
So between our 2 clinical sites, we have access to over 250,000 patients per year. This means that we have plenty of opportunities for critical care and for procedures, which makes our clinical experience excellent. We're quite proud of our clinical experience, but we're also quite proud of our didactic experience, which we call the Modular Active Learning Curriculum for Emergency Medicine, or by its acronym, MALCOM. The Malcolm curriculum was developed by our residency's founder and original program director, Dr. Michael Allsweed. He devoted a significant portion of his career to researching adult learning theory and developing a curriculum that specifically caters to adult learners.
When I started my first residency program, I wanted to adopt a adult learning style curriculum. Adults accept facts and retain facts when they become useful to solving a problem. The Malcolm curriculum consists of an integrated set of assigned readings with a formatted transactional knowledge building discussion in which we use a flipped classroom approach. The knowledge building discussion feeds into then a simulation, which is the kinesthetic component of the learning. The Malcolm is a education by design. Each module is a discrete piece of the overall curriculum of emergency medicine, and each piece is taught with specific endpoints. It is not a haphazard way of instructing emergency medicine.
Our curriculum is designed to make learning an active pursuit, taking the place of hours of passively following along electronic slide-style lectures. Each week, our residents read between 50 and 80 pages of articles that we discuss the next day. And the night before, we give you the night off so you can read. It's good.
It's real good.
Every week, we have a flipped classroom discussion like this. Say hi, everyone.
Hi.
This is where our residents get the opportunity to discuss the week's readings, and our facilitators are tasked with making sure that the best points from each of those readings is discussed.
We have talented teaching faculty who have become quite adept with this style of teaching. They work hard to make sure that discussions are engaging and fun.
Our curriculum is designed to challenge residents and push them to think critically about the literature. The feedback from our residents about our unconventional curriculum remains quite positive.
Hi, I'm Dr. John Rushton, the Simulation Director. Simulation is a core part of our curriculum. Every week we run multiple high-fidelity cases on our state-of-the-art lab. This hands-on training builds confidence, sharpens critical decision-making, and elevates our residents' skills so they are ready for real emergencies in the ER.
Hi, I'm Dr. Crystal Turgis, and I'm the director of the Mass Casualty Simulation. Every year we collaborate closely with our nurses, paramedic students, and multiple EMS agencies in the execution of a large-scale mass casualty incident simulation. Our sim team creates over 140 unique patient scenarios for residents to triage and treat within just a few hours. Our simulation begins at a remote site where EMS teams assess, tag, and transport patients to Mountain View. There, residents and nursing staff work side by side to provide emergency care, performing critical procedures under realistic, high-pressure conditions.
Welcome to Midlist. This is my vintage store. This is where I decompress. Here at Sunrise, we take work-life balance really seriously. As the wellness director for the entire consortium, I make sure our residents have time to do the things that they love outside of work.
Hi, I'm Dr. Amber Mirajkar. Dr. Turgis and I quarterly will gather female resident and attending physicians for our Women in Medicine meetings as part of our overall wellness curriculum.
This is a time and space that allows us to come together, talk about issues that are centric to the female physician in the workplace, allowing us to build community and mentorship.
We take great pride in our residency and feel a strong obligation to our residents to make it the best program it can be. It is our goal to make our residency one that our residents feel fortunate to be a part of and proud to graduate from.
Thanks for taking the time to get to know us. We look forward to meeting you soon.
Come join us!